Before doing suction for a patient, Yango tubing has to be attached to the wall suction to the patient side connection. After attaching it to the patient side connection, then the wall suction has to be switched on. You can adjust the pressure using the knob. Once it is on, you have to check the pressure and it should not exceed more than 200. After checking the pressure of the suction, you have to pre-oxygenate the patient at least for 1 minute and also monitor for the saturation. If the saturation is fine, then you can continue with the suction. Check the cardiac monitor to know how much is the saturation level of the patient. If the patient is maintaining a saturation of more than 93, then you can continue with the suction. Check the monitor whether the patient is maintaining the saturation. Here the patient is maintaining a saturation of 100%, so you can proceed with the suction. First, before doing the procedure, you have to wash your hands. Follow 6 steps of hand washing. Check for the articles that has been arranged. There should be a hand rub to wash the hands, then a paper gloves, a syringe that contains saline and also a saline bottle. After arranging, wear the paper gloves which will be sterile. Then peel off the paper. Now you are ready for the procedure for suction. Switch on the suction knob. Connect the Yango one end to the patient suction port, closed suction port. After connecting it, insert the closed suction catheter into the trachea. Once it's reached this trachea, you have to pull out by pressing the knob, blue knob down. And you have to keep the suction catheter inside the trachea for 10 seconds and withdraw it. After withdrawing, you have to flush the suction catheter through the flush port with 20 ml of saline. Before doing closed suction, you have to first check the wall suction and adjust the pressure. Pre-oxygenate the patient for 1 minute. Check for the patient whether he is attaining the target saturation. In order to perform open suctioning, you have to arrange the articles. Hand rub, a 100 ml saline to flush the line, a paper gloves, a sterile surgical blade in order to open the saline, a 20 cc syringe or a 10 cc syringe, and a suction catheter of appropriate size. Now wear paper gloves. The procedure will be entirely sterile. Take the assistance of one more nurse. Before doing suction, you have to attach to the rubber pipe. Now connect the suction catheter to the Yango tip. Make sure that the suction catheter tip should not touch anything before entering into the tracheal opening. Now remove the ventilator connector. Directly enter inside the trachea. Once you feel the resistance, in a rotating manner, remove the suction catheter. You have 10 seconds to remove the suction catheter. Now close the ventilator circuit. Flush the suction catheter with 100 ml saline. Use one suction catheter for one suctioning. After your suction procedure completely, use the 100 ml saline and you have to discard it in appropriate place. Now let's see how to perform supraglottic suctioning. In order to perform supraglottic suctioning, a 10 cc syringe has to be attached to the supraglottic port and secretion has to be removed. Even a Yango tube can be connected in order to remove the secretion. After removing the secretion, you can close the supraglottic port. Discard the gloves in the appropriate bin. Perform hand hygiene. I hope you understood the suctioning procedure. Thank you for watching the video.